Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with the cause of skin eruption investigated. Yes, this topic is interesting because my friend, one of my close friends, sends me a movie, like a video, it's a very short video of his ailment, which he has surely recovered from. It's something of interest that brought him down, and he was saying he thanked God for it. But what was the cause? Because that is my area of interest. The cause of the problem. The area of interest of any medical laboratory scientist is to unravel the mystery of any disease. And that is why I was so interested in really sharing this video and my thoughts. If you like my presentation, please press the like button, subscribe, and for sure, more of these interesting videos will come your way. But for the moment, let us move on to the slide section where so much work will be done. As the outline of what we are supposed to go through: objective, video clip, introduction, names of some skin eruptions, lab diagnosis, prevention, and or conclusion. The objective: to unravel the mystery of some skin eruptions that are of known etiology, thereby allaying the fears associated with them. Yes, this is the video clip. You can see the vesicles, you can see that vesicle and I think the blue pus and rashes. All these skin eruptions, they are indicative of something which we know. The introduction. Skin eruptions are also called dermatitis, rashes, erythema, and when itchy, they are also called pruritus. The main cause of skin eruption is dermatitis, which is when the skin reacts to allergens, bacteria, viruses, fungi, and conditions like eczema, hives, and psoriasis. Skin rashes are a common symptom of many viral conditions such as chickenpox, measles, molluscum contagiosum. Skin eruption causes could be dermatological, systemic, neurological, psychiatric, when you probably the fear, phobia, and what have you, multifactorial, and even of unknown etiology. Names of rashes. When you look deeply, you will see that there are rashes on this skin in the picture. It is not raised. The description is as follows. It's a macule. Called a macule, it is a circumscribed discoloration. You can see the discoloration of the skin. It is not raised like a nodule above the surface of the surrounding skin, and it can evolve into purple and could be called maculopapular. Yes, it could graduate into a purple. When you look at this, it's raised. A purple is a small nodular elevation of the skin. Such lesions are common in chickenpox and smallpox. So when you look and it's red, that is indicative. When you look at this picture very clearly, you will see that there are raised nodules and then you have vesicles. That is, vesicles are small blisters containing clear fluid like water. These may be scattered irregularly over the skin as a chickenpox, like the picture, the video clip that you've just seen, or group in clusters as in Apex zoster and Apex simplex. So when you look at this, you can see the similarity between these and exactly what the video clip showed us. The next one is the pustule. You now see the vesicle water disappearing, and you more or less have pus inside it. A pustule is a small elevation of the skin containing pus. It may form directly as a result of the local sepsis or evolve from the vesicle, as we have just said. The pustule can gradually start healing and form crust. A crust or scab is a congealed exudate on the skin Cross are a prominent feature in impetigo. Impetigo is infection with some bacteria like streptococcus and possibly staphylococcus, and are a terminal stage in the evolution of vesicular eruption. That is, when you start seeing cross, it means the rashes or whatever, the skin eruption is gradually disappearing. Let's talk about a wheal. A wheal is a localized effusion of fluid. Look at this film clearly, you see that there's like a white or pinkish space there into the skin, causing a raised white or pinkish white area with halo of erythema. Erythema is the nodule. When you see nodules, it's called erythema. Wheals vary in size and never rupture. They are characteristics of allergic rashes. Allergic rashes are more or less not infectious. It's as a result of probably allergy to something, and are especially florid in serum sickness. Yes, an erythema is a nodule, sort of. It's a diffuse or localized redness of the skin. The character of an erythema is varies considerably with different diseases. An erythematous patch with a pale center and intensely red margin is described as scintillant. So when you look at this skin, you can see the nodules. It's coming. The rashes are coming out, although they are more or less diffuse, but you can see them clearly as appearing one, looking like they are in cluster, but not so much. They are still individualistic, and you can talk of erythematous nodosum or erythematous nodules. Yeah, this skin eruption looks so similar to the first one, but the vesicle is not as big as it. So you can compare, and that tells you what is likely the problem with the close friend of mine. Well, let's look at what it could likely be. It could likely be shingles. Shingles is a famously painful blistering rash caused by the reactivation of chicken pox virus, varicella zoster virus, usually years or decades after the original infection. You know, skin problems are common with children. Adults have more or less developed some immunity against it, and you don't expect. But with old age, the immunity has really reduced, and so the virus can reoccur. The virus lie dormant in nerves near the spine and migrate down the sensory nerves of the to the skin when it is reactivated, but it is not known why the virus is reactivated. Some possible triggers are radiotherapy, spinal surgery, other infections, or possibly cancers. So, but one can also rationalize it as when the person is immunocompromised. Yeah, laboratory diagnosis. If the dermatitis is tinea, you have tinea on the skin and it's called tinea corporis. If it's on the head, it's called tinea capitis, and so on, leg tinea pedis, which is caused by fungi. It would be very scaly and ringworm-like. In this situation, we are seeing vesicles and pustules, and the suspicion is viral infection, which can be cultivated in tissue cultures or egg, depending on the predilection of the suspected virus. The non-specific test would be IgE estimation. It could also be stained to confirm bacterial infection or skin testing for tuberculosis. The tests are many. In conclusion, shingles start with pains. Patients often have a fever, headache, and swollen lymph nodes. That I did not ask my friend, but the complaint sounds almost like that. Recovery can take 2 to 4 weeks, but the pain can persist after the rashes has healed, called postherpetic neuralgia. If it's caught within 3 days of onset, antiviral medication can reduce the severity of the symptom and length of the infection. Otherwise, treatment consists of powders or solution to dry out the rashes, as well as pain relief and rest. Australian aged over 70 years, like my friend, are eligible for a free zoster vaccine. So this is just the preventive way to prevent such thing happening, which reduces the risk of shingle by half. And that's the report of Professor of Dermatology from Petersov. So yeah, we could also think of boosting our immunity. When you boost your immunity, the body becomes perfect. It's not immunocompromised in any way, and so probably prevents that kind of thing happening. There are so many things one can do. The vitamins, because as we grow older, we are more or less becoming more susceptible to things that originally we have built immunity.